Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting stories from the world of health IT. Today on the program, we're going to be talking about a topic that I know some of you are saying, oh, again? But we're going to cover it in a new way. We're talking about interoperability. And joining me on the program today are Brian and Hamad from PointClickCare. Gentlemen, welcome to the program.
Thank you.
Thank you for having us.
Great to have you. Thank you for agreeing to sit down with me and talk about interoperability with some more edgy questions. I'm looking forward to it. But before we get started, maybe if each of you could just introduce yourself for our audience, your name, your title, and just a little bit about PointClickCare.
Sure. So thrilled to be here. Brian Drozdowicz. I oversee the hospital and health plan business at PointClickCare. Been here about a year, but 20 years in the space. So while the business is new to me, the market it certainly is not. We run a full nationwide real-time network connecting hospitals and health plans back to our core business in the LT-PAC senior care market segment. So super excited to be here and spend some time with you today.
Yes, my name is Hamad Husainy. I'm an ER physician by training. I've been with PointClickCare for almost 2 months, but I've consulted with one of their acquisitions, Collective Medical, for several years in the past. I'm the Chief Medical Officer, and my main role is working with the acute and payer side and working through opportunities to use the product more and connect more people to it to get the information needed at the right time.
I mean, I'm pretty excited because the way you've described PointClickCare is not how most people think about PointClickCare when they hear that name, right? For years and years, PointClickCare was synonymous with long-term care, post-acute care. You're talking about payer relationships, and we're going to talk about interoperability. This is exciting that your organization is moving so aggressively into this new direction. And the fact that you're here with this big giant booth at the conference.
That's right.
So let's get to it. It's 2024, right? We've just had some new legislation talk about information blocking and transparency as it relates to data. And we are still talking about interoperability. And I'm not seeing, at least at the this level, a lot of meaningful action. Yeah. Am I wrong? Are we actually making progress and I'm just not seeing it? Guys, talk to me about that. What's going on here?
Yeah, so there's a lot that's happening out there. And,
okay.
Of course, there's a lot with regulation, with information blocking. TEFCA, some states like California have their own digital exchange framework. And I call that, it feels like very much a forced set of regulations that everybody's moving towards there. And early days on all of those, the value that's being derived based upon the introduction of those standards, it's still too early to tell. The approach that we've taken, and we think of the world as a very open place, and we play along well with the standards where it makes sense to. But ultimately, the business that we've built, of course, PointClickCare is known really well for our LT-PAC senior care business, a large market footprint there. What we've essentially done is marry that together with the largest nationwide acute and payer network, connecting all those constituents in the marketplace together. And we're doing a ton of work right now connecting acute and post-acute in a way that no one else has really done this before. We've had tremendous growth with that over the past couple of years. We just had our customer summit last week, about 2,500 folks there, and many on stage talking about real ROI and clinical outcomes that they've been able to achieve through the use of some of the data sharing capabilities that we've got up and running. So it's a long game here, right? And I think that this is my 16th HIMSS, if I'm counting right. And we had this conversation 16 years ago. It's a little different now, but we are slowly but surely getting there.
It sounds like what you're saying to me is I still have to be a little more patient.
You have to be patient.
You have to be more patient. Hamad, what are you seeing? Like, from your perspective?
I see there were interoperability and the opportunity to share this information came on the national stage, but there really wasn't a lot of teeth in it. And through some of the new regulation and new sort of clarification through the federal laws, they're bringing some teeth to it where it's tied to dollars. And I think that moves the needle. And so we're excited to be able to be part of that and really just, define the system and help become more interoperable.
So, but for you, as we sort of improve interoperability, how is that manifesting from a clinical or patient perspective, especially given your background?
Absolutely. So, as a clinician and as a clinical leader here at PCC, it's very important that I keep the patient first. At my core, I'm a clinician. And so, when metrics were created and health information was created, it was the goal was to improve outcomes. It was to improve morbidity, mortality. It was to improve, ultimately death and things like that. And so, one of the values here is to be able to bring the patient into that and be able to get the right information at the right time, in the right setting, for this. Brian mentioned that we had a summit a few weeks ago, and it's so gratifying to hear some of the outcomes that actually have occurred from some of our users. On the second day of that, we had some presentations from some of our clients, and one of our clients, which is an ACO up in Ohio, shared that after initiating our care collaboration software, they were able to reduce readmissions from 25% to 8%, and that's ROI, that's value. But even putting my clinician hat back on, those are patients. That's 17% of patients that didn't have to go back into the hospital, and really resonates with people ultimately. And that's how we see interoperability, work practically.
Now we've all talked about here, the power of regulation and policy to move the needle in healthcare, and being a regulated industry, of course it will. But in my opinion, to really move the needle requires incentives, specifically financial incentives or disincentives. Is there anything we can do around incenting or disincenting more care collaboration, and really able to move that needle when it comes to interoperability? Therefore, is there something we can do?
So there's quite a few different value-based programs today that we essentially are the backbone in sharing data for our customers. So ACO Reach is one of the bigger ones. MSSP. We've got a bunch of our senior care customers also participating in different SNP programs. And when you unpack these, there's a certain degree of incentive just to be in them and to be an early adopter of them. Ultimately, to perform against them, you have to share data.
Sure.
And because we've sort of opened up both sides of our network, where we're sharing the acute data with our senior care customers and our senior care customers with our data with the acute side, we're seeing tremendous things. Like interoperability is a technology thing. What we've really tried to focus on is the collaboration between the constituents that historically have not had the strongest of relationships. So we've taken this approach, and we've done this in many of the major markets in the U.S. today. We have care collaboration conferences. It's a very organic thing, and we bring together, of course, the customer base that we've had for quite some time with our senior care side of the business. We marry that with inviting in all of the provider organizations and have them openly talk about the challenges that they have in sharing data, and ultimately how PointClickCare as an organization can help them on some of these things. So we've introduced a tool that sort of sits in the middle of it, and the tool is fired up and powered by data that is shared from both sides, and we've had some fantastic outcomes, as Hamad mentioned, in terms of interoperability and that collaboration.
What do you think, Hamad? Is there something we can do to really financially incentivize interoperability?
Yeah, I think we have to align our goals. We have to get goals aligned so we're all sort of rowing the same way, which is not an easy task. But from a clinical standpoint, looking at this and seeing how it practically works, we're working on, especially with our collaboration with the post-acute care side and the acute care side, we're improving communication between post-acute care to the acute care, return to hospital visits and things of that nature. And so there's a very straightforward picture created on how we can reduce costs, reduce utilization, as well as reduce readmissions. And with all of this, we feel health systems, ACOs, payers should all benefit, and ultimately the patient should benefit the most.
So it's encouraging to hear you both say that there is some hard dollar ROI here and some pretty good incentives. I mean, I am hearing though, a lot of it is intrinsic still, in the sense that you're going to do a better job for your patients, you're going to be more efficient, that's going to benefit you. It would be nice though to see some external incentives for that kind of thing. Hopefully maybe the payers will come into play for that. But as you said, I have to be patient.
Yeah.
I have to be patient for that. So gentlemen, give me some hope. Give me some hope here. As you stare into your crystal ball, what do you think will be changing in the year ahead when it comes to interoperability? Where are we going to go? What strides are we going to make?
Yeah, so TEFCA's out, TEFCA's live, super early innings on that game. I think it'll be really interesting to see how the QHINs around the country work to support those interoperability standards. It's not necessarily real-time actionable data right from the start. I do believe we'll get there with time. This is one of the first major interoperability changes and standards in at least a couple of years. So we're hopeful that will help to drive some things. We certainly have our eyes on it closely, and like I said, we'll absolutely contribute and play ball where it makes sense.
And I think interoperability has to become a phrase and a term that's recognized and understood all the way down to the bedside. And I think until that happens, it's going to be a tough sort of cookie to bite off, so to speak. But I think what we're doing with the information exchange and being able to share that across the care continuum, it will really help it get down to the bedside. And once we get the buy-in from the clinicians, I think it will be a lot more helpful than what has been done previously.
And specifically, what is PointClickCare doing in terms of, you talked a little bit about it, but is there anything specific that you want to tell our audience about in terms of the interoperability work you're doing?
Yeah, so, PointClickCare has the largest care collaboration network in all of North America, and we're growing every minute, every hour, every day, and that's exciting because the more connections we can make, the better that we can, be more interoperable, provide better care, and actually save lives. And that's really something that I'm very passionate about. We need to break down these silos, and that's what we're continuing to do. Hopefully, where there's no more silos one day, and we have an absolutely frictionless system where the patient can go from the ER and into the inpatient setting, to the post-acute setting, and even if they come back to the ER setting, where all that information, the right information is given at the right time for the right patient, for the right provider. When we accomplish that, I think we're going to see a healthcare system that thrives.
Just to pile on to that, from a product and investment standpoint, we recently celebrated being ONC CHRT certified for our LT PAC solution, which is the first and only in that segment of the market that has been certified. That with that comes a lot of process rigor and product investment to ensure that we're capturing the right information, we're storing it securely, we're sharing it appropriately when needed, and the market can certainly lean on us and trust that we're going to continue to invest in these things. We see this as table stakes for the business that we want to run in the future.
Brian, Hamad, you guys have shared a lot of great information with us today on the program. Where can people go to learn more about PointClickCare?
Lots of places. LinkedIn this week is a wonderful place to look at all that's happening. We've got quite a few discussions that'll be captured there. We're doing a lot on social media, of course, the traditional website, but LinkedIn is where you'll see all the action this week.
Excellent. And where can people go to see the website for PointClickCare?
PointClickCare.com.
Excellent. Well, gentlemen, thank you so much for being on our program today. Really appreciate your time.
Thank you. Appreciate it. Thanks for having us.
And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.